Hello everybody, my name is Marnix and this is my partner Mikaella. We will be doing a presentation on prenatal diagnostics specifically for Australia and Kenya.
Prenatal testing is a type of testing that allows us to check the health of the fetus for any abnormalities or genetic disorders. This allows the parents to prepare mentally, financially, or medically. There are two types of prenatal testing: screening, which gives us a risk of having the disease, or diagnostics, which gives a definitive yes or no answer. Genetic testing is advised for all women, but diagnostics is specific for hereditary disorders when they run in the family, or when the female is above 35 years old. Apart from the benefits of prenatal testing, we also have risks, such as a miscarriage in 1 out of 750 cases.
To briefly introduce both countries, we can see that Kenya is a developing country while Australia is a developed country. Kenya has a much larger population size. However, the GDP of Australia is significantly higher, 2,000 times higher actually. Kenya has a higher fertility rate.
In Australia, we have the Camerons. They have been trying to get pregnant for a while. Once some pregnancy symptoms starts, they take a home pregnancy test, and when it's positive, then they schedule their first visit to the doctor. There, some urinary and blood tests are taken, and the pregnancy is confirmed. Then, the due date is calculated. Mrs. Cameron is given some lifestyle recommendations for the health of her and the baby, and some information about antenatal care. There is an average of 10 visits during every pregnancy in Australia. The available screening tests usually are ultrasound and maternal serum testing, which looks at the DNA of the baby. If the risk is very high, then they move on to diagnostic tests. These include chorionic villus sampling and amniocentesis. They usually test for Down syndrome or cystic fibrosis, the two most common diseases in Australia.
Just like the Camerons, the Mwangis also wanted another child. The mother, she noticed that she missed her menstrual cycle, so she decided to do a pregnancy test. This turned out to be positive, so she decides to visit a public hospital because she can afford this. Well, things which are being done is determination of the pregnancy stage. Her due date is calculated and an HIV test is conducted. HIV is still a huge problem in countries like Kenya, so this is a mandatory thing in countries like Kenya. Also, a blood test is conducted and very little lifestyle advices are given to the mother because there's very little knowledge about such things in those countries. On average, you see that a mother visits 4 times during her pregnancy a hospital. You can see that in this pie graph that during the 2nd trimester, most mothers visit a medical expert. Overall, prenatal testings are getting more and more popular and more accessible for mothers. However, still it's something which is mostly for the rich people. Diseases like malaria or trisomy abnormalities are things which are regularly tested in these countries.
In case of a positive test and a genetic abnormality, in Australia you have the mental option to get emotional support from experts, and medically you have the option of abortion or genetic treatments. In Kenya, none of these options are available for the women.
Concerning financial support, in Australia 80% of all expenses are covered by the government, while in Kenya the public healthcare system is still very limited. That's why you see NGOs like the World Bank creating new funds to improve the standards. Also, there's a booming business with the private healthcare systems. You see that private hospitals are created, but this is only for rich people. A conclusion, you can see that the Camerons have way more assistance, they have financial support, and they have the autonomy to do abortion.
This is also seen by the significant difference between infant mortality and maternal mortality between Kenya and Australia.
So to briefly summarize, you can see that in Kenya there is a lack of education There's a lack of resources, lack of accessibility to healthcare, and still financial support is an issue in countries like Kenya.
These are resources. Thank you for your attention.